Good day, everyone. This is a common station in the MRCS Part B exam, and it's a common mainly in any anatomy exam, actually, not only for the MRCS Part B. So in this case here, they are going to ask you some questions mainly about the blood supply of the stomach. This is the stomach, and they are going to ask you about the blood supply and the anastomosis around the blood supply and their origin and so on. Definitely they are going to ask you what it is, the fundus, the body, the antrum and so on. You all know this, but the blood supply is a true dilemma for most of us. So we are going to see an illustration. So during the stressful conditions of the exam, you are going to be aware about what are you talking about. So let us go to the illustration and it will become easy for you. Well, so you want to know that almost all the blood supply of the stomach is coming from the celiac trunk, okay? Sometimes they may ask you in detail about the celiac trunk, sometimes, and they are going to be questions mostly, but regarding the stomach, you are going to show it on the cadaver or in the maquette or whatever they are using in your center, okay? So the main blood supply of the stomach, mainly, there are actually 5 arteries involved in this. The first is the short gastric arteries. The second is the left gastroepiploic artery and right gastroepiploic artery. The third, right gastric artery and the left gastric artery. These are the 5 arteries responsible about the blood supply of the stomach. Okay, so you are going to show those on the cadaver or the picture, whatever is going to be shown to you. We are going to see this later, but you want to know about the celiac trunk, because if you understand the celiac trunk, you are going to understand all the story. So this is the celiac trunk here. It has 3 main branches, as you know. Okay, the first main branch is the common hepatic artery. The second main branch is going to the right toward the liver, and the second branch is going to the left toward the spleen behind the stomach, and the third branch is the left gastric artery itself, which goes directly to the stomach, the upper part of the lesser curvature of the stomach. Okay, so here, as you see, this is the splenic artery moving directly behind the stomach and going to the spleen. Okay, so from here you want to consider the left gastroepiploic artery, because the left gastroepiploic artery and the right gastroepiploic artery are connected here, but they have different sources. That is why this is a very powerful anastomosis in the great curvature here. So this here is from the splenic artery, and this one is coming from the gastroduodenal artery. Gastroduodenal artery is a branch of the hepatic artery, common hepatic artery. So the gastroduodenal artery has the right gastroepiploic artery branch here, and the splenic artery has the left gastroepiploic artery here. They are meeting and covering the great curvature of the stomach. Okay, there are other branches for the gastroduodenal artery. This is not our issue now, but we want to consider the left here. As we mentioned, there are 2 arteries that are covering the lesser curvature of the stomach. One of them is coming directly from the common hepatic artery, as we mentioned before. The third one, which is going upwards and leftwards in the left direction, and it goes directly to the stomach, covers part of the esophagus, actually lower esophagus here. Okay, and here from the common hepatic, from the proper hepatic artery, which is a branch of the common hepatic artery, there is a small branch that is called the right gastric artery. It supplies the lower part of the curvature. So here we find the left gastric artery, and here we find the right gastric artery. The left gastric artery comes directly from the celiac trunk, and the right gastric artery comes from the proper hepatic artery, a branch of the common hepatic artery, a branch of the celiac trunk. Okay, again, okay. So here on the greater curvature, we have two arteries. This is the left gastroepiploic artery. It's coming from the splenic artery here. Okay, and we have the right gastroepiploic artery coming from the common hepatic artery, a branch of it actually, which is the gastroduodenal artery. On the right side, or the lesser curvature, we have the left gastric artery, which is coming from the celiac trunk directly, and we have the right gastric artery, which is coming from the proper hepatic artery, a branch of the common hepatic artery, a branch of the celiac trunk. And finally, we have the short gastric artery. So now you want to demonstrate this here. You want to show it for the examiner here, okay? Especially if the if it is introduced to you through a cadaver. So sometimes cadaver, sometimes something artificial, you get sometimes photo. Depends on your center. So here now you understand the blood supply of the stomach. There are 5 sources of blood supply for the stomach. Okay, so here this is the spleen, here this is the liver. They may be there, they may not. It doesn't matter. So here this is the fundus. Fundus is related to the short gastric arteries. Okay, most probably you will not be able to see it, but if it is apparent there, they may ask you about it. Okay, here the left gastroepiploic artery is going to show up here. Okay, and here this is the right gastroepiploic artery, a branch of the gastroduodenal. As you know, this is related to the greater curvature of the stomach. So let's go to the lesser curvature of the stomach. We know that we have right gastric and left gastric. Don't worry about this mess at all, okay? Because if they ask you about an artery here, this number 12, this is the left gastric artery. They may ask you, where does it come from? You are going to tell that it is coming from the celiac trunk directly. And here you are going to find the right gastric artery, a branch of the proper hepatic artery. Okay, so that's it, and I wish you a good luck.